Insight-Nexus-News report, The Impact of Sugar on Children's Behavior and Health. Date, November 9th, 2024. Welcome to Insight-Nexus-News. I'm Liara, and today's deep dive covers the powerful, pervasive role sugar plays in our lives and its potentially detrimental impact on children's health and behavior. We'll explore sugar's history, the stronghold of the sugar industry, and recent research linking sugar consumption to both behavioral and physical issues. Stay tuned for an eye-opening exploration of a substance that has reshaped diets, economies, and policies worldwide. Historical influence of sugar and Big Sugar's rise to power. Sugar has a surprisingly complex history, transforming from a luxury item in ancient times to a staple in households across the globe. By the 18th century, sugar was already a central product in the Western economy, contributing to colonialism and the slave trade as European powers sought to monopolize production. Fast forward to the 20th century, and sugar companies evolved into immensely powerful corporations, with the United States being a prime example of the industry's influence. By the 1970s, the sugar industry was already maneuvering to shape public perceptions and dietary guidelines. Studies initially linking sugar to obesity and heart disease began to worry sugar producers, prompting a highly organized effort to suppress damaging research. Big Sugar funded scientific studies to downplay sugar's role in these health issues, instead shifting the blame onto dietary fats. Influential studies, later exposed as biased, helped promote the low-fat diet trend, indirectly increasing sugar consumption through low-fat foods laden with added sugars for flavor. The industry's influence also extended to regulatory bodies. Through well-funded lobbying efforts, sugar companies were able to influence the U.S. Food and Drug Administration, FDA, and other government agencies. In the 1980s, sugar guidelines in food labels remained vague, with limited efforts to regulate the industry or alert the public to sugar's potential risks. Today, despite increasing transparency, the sugar industry remains a formidable lobbyist, continuing to resist tighter regulations and labeling requirements. Behavioral implications of sugar consumption in children. Mounting research suggests a link between sugar consumption and behavioral issues in children. This connection, although still debated, appears in numerous studies and reports from parents and educators. Sugar is known to cause sharp blood glucose fluctuations, which can lead to hyperactivity, irritability, and mood swings, particularly in younger individuals who are more sensitive to such spikes. 1. Hyperactivity and mood swings. A notable study published in the Journal of Pediatrics revealed that sugar spikes and subsequent crashes can create symptoms that mimic attention deficit hyperactivity disorder, ADHD. While sugar itself may not cause ADHD, children predisposed to hyperactivity may experience worsening symptoms when consuming sugary diets. 2. Attention and focus. Research from the University of California, Los Angeles found that diets high in sugar can affect cognitive functions in children. The study linked high sugar intake with impaired memory and reduced focus, affecting a child's ability to pay attention in school and retain information. 3. Addiction and craving cycles. Dr. Robert Lustig, a neuroendocrinologist and leading critic of sugar, explains that sugar activates dopamine receptors in the brain, leading to reward-seeking behavior similar to addiction. Children who frequently consume sugary foods can develop dependency, resulting in mood instability and irritability when their cravings aren't met. 4. Increased risk of anxiety and depression. Although studies are ongoing, there is evidence suggesting that sugar may affect mood in ways beyond simple hyperactivity. Research has shown that diets high in refined sugar may contribute to inflammation, affecting both body and brain. This inflammation could contribute to conditions like depression, anxiety, and mood swings in children. Health implications beyond behavior. Excessive sugar consumption also has far-reaching health impacts, often setting the stage for lifelong conditions. Childhood obesity, diabetes, and fatty liver disease are some of the more pressing health crises linked to sugar. Obesity and type 2 diabetes. High sugar intake is a known factor in the obesity epidemic affecting children worldwide. Sugary beverages and snacks, often more affordable and accessible than healthier options, contribute to weight gain. Obesity, in turn, increases the risk of type 2 diabetes, a condition now seen increasingly in children. 2. Dental health. It's no surprise that sugar is directly linked to tooth decay. Pediatric dental care statistics reveal high rates of cavities and gum disease in children consuming sugary diets. Excess sugar feeds harmful bacteria in the mouth, resulting in acid production that erodes enamel, leading to painful and expensive dental problems. 3. Heart disease. Though often associated with adults, heart disease risk factors start early in life. A study from the American Heart Association recommends that children's sugar intake be capped at 25 grams per day. Consistently exceeding this limit can lead to elevated blood pressure, insulin resistance, and eventually cardiovascular disease. Notable case studies and industry impact on research. The infamous sugar study controversy from the 1960s and 1970s exemplifies the industry's manipulation of science. Harvard scientists, funded by the Sugar Research Foundation, deliberately published findings that downplayed sugar's health risks, deflecting focus onto dietary fats. Decades later, this bias was uncovered, fueling widespread mistrust toward industry-funded research. Similarly, in the 1990s, sugar companies managed to downplay concerns about high-fructose corn syrup, a key ingredient in processed foods. This sweetener became a staple in sodas, snacks, and processed goods, contributing heavily to obesity rates. Only recently have some regulations been introduced requiring clearer labeling on added sugars, yet the industry's influence on dietary guidelines continues, raising awareness and advocating for change. It's clear that the impact of sugar goes beyond physical health. Its effect on children's behavior, learning, and emotional well-being is a serious concern. Health experts and nutrition advocates argue for several steps to reduce the sugar epidemic. 1. Education and awareness. Many families are unaware of the hidden sugars in foods labeled healthy or low-fat. Public health campaigns aim to raise awareness, teaching families to read labels and recognize hidden sources of sugar. 2. Improved food labeling. Governments are beginning to address the need for clearer food labeling, showing not just total sugars, but distinguishing between natural and added sugars. Clearer labels can empower parents to make healthier choices for their families. 3. Policy changes and taxation. Some cities and countries have introduced sugar taxes on sugary drinks, reducing consumption rates. While controversial, this measure has shown promise in regions where it has been implemented. 4. Incorporating healthy diets in schools. Schools are increasingly focused on nutrition education, promoting healthier choices in cafeterias and vending machines. By introducing nutrition-focused curricula, schools help instill healthier eating habits from a young age. Conclusion. The story of sugar is not just about sweet treats. It's a tale of influence, science, and the far-reaching impacts on health and behavior. As we better understand sugar's effects, it's crucial to scrutinize our food choices and push for transparency in food production and labeling. Children, especially, deserve diets that foster health, stability, and concentration, giving them the best foundation for a bright future. Thank you for joining us on Insight-Nexus-News. Please remember to like, subscribe, and share this report, helping others become more aware of the powerful role sugar plays in our lives and in our children's futures. Stay tuned for more in-depth reports.